It's made my education really difficult because I have a very practical course and I don't get the contact hours I need. Doing photography, you need like constant feedback, you need access to the equipment. So doing a arts degree online is really hard. Um, but we're trying our best, and the university does support us really well. Yeah, it's been really difficult because I'm really close to my family and I can't like pop home when I want or like see my mum or my grandma very often. I think that's the hardest thing, like not being able to see my grandma. But um, friends wise, it's you can still go for walks and stuff, but it's not got the same social aspect, and you do miss being able to just give someone a hug and like to spend time with anyone without having to think, oh, I need to be 2 meters away from them. I can't do so that it is a lot of change, but we're getting used to it now, I guess. Um, it's kind of weird. It doesn't. It's kind. I find it quite hard to remember what it was like before. I know it's not been in the grand scheme of thing a very long time, but having to change so much, like thinking before you meet someone, like you automatically just go to greet someone in a certain way, and you have to really. I still find I have to check what I'm doing and think, oh, I need to remember like my mask, hand sanitizer. I need to, I can't touch that or I can't go near this person. Um, it's a lot of like extra thinking and planning. So yeah, I find I have been struggling with it, but it's gotten a bit easier as restrictions have lifted. But obviously we're back in another lockdown, so it's time to go back to how it was in March. I think we have kind of been forgotten quite a lot, um, in the sense that we don't really have as much support as businesses and everything. Like as students, we've not we've just been I don't really know how to put it. Like with schools and that, there've been very clear instructions, whereas universities, there've been like you can go back, but there's not been any like clear rules. Um, Personally, my uni's been quite good, but they have been difficult for them because like we obviously want answers from the tutors, but if the tutors don't have answers from the university, then we are all kind of stuck in this loop of asking questions. Um, so it's been quite difficult trying to get the answers you want when they're not really available, and the university's always having to try and find stuff out for you, and it's quite a long process. But I think in the grand scheme of things, they have been really good to us and they've kept us updated, like with the traveling home restrictions. They've allowed us to go online for the final week so we can all get home safely. So I think physically, I haven't noticed a lot of change because I mean, we're not moving around as much because obviously we can't go outside. And I think not being able to go outside as much like is difficult because I used to always be outside, like going for walks, all sorts. And we can still kind of do that to an extent, but you feel a lot more restricted in like physical activity and that. But it has impacted my mental health quite a lot because I'm quite a people person. I'm a hugger as well, and I really enjoy going into uni. I enjoy going just randomly going and having plans with people like, oh, we'll just pop and do this, and like just being able to nip around people's houses for a catch up and that. So I think being inside a lot it has impacted on my mental health, but it's opened up a bit, and it's the change in the season as well. There's lots of factors, but I think like as everything's opening up and getting a bit back to normality, I felt it's got a bit easier. I've always experienced relatively good health. Like Never really had any issues other than like common cold or anything. That's not really an issue, but my grandma has quite a few health issues, and so does my uncle. So I worry about them a lot. But in the grand scheme of things, we're all relatively healthy. Like it's not been. I don't think our health is that bad. Compared to other people anyway. Definitely not. But I don't overly worry. I think they definitely do. I think people have access, it's all about access really. Like if people have more money, they can access private healthcare, whereas we have to go through like NHS and there's a wait list, and it's a bit more of a long-winded process if you compared to those who have can just go to private. But I don't. For me personally, I very rarely go to the hospital or the doctors because I don't feel I need to. I said I like to. If I unless it's something really pressing, I won't go because I think someone else will always need it more than me. Um, but it's like 111 is a good thing. Any queer, like anything that we really don't know about, then we'll either search it or but we'll find it out our own way rather than like wasting resources. Um, I think possibly more support. Not really for me, like I don't particularly need anything, but for my grandma specifically, like she's recently been able to get access to district nurses and that, but I think that would have been nicer to have had sooner, because she has mobility issues. So she had a lot of help, but then I feel like she could have had more help with her walking and everything. But then also if we don't ask, we don't get. So it's a difficult one because you need to ask for it, but also there's not as much availability as I would like them to be, I guess. Um, but yeah, so I guess more support for people in general rather than just those that can afford it.